By the end of this submodule, you will be able to identify the common shoulder and back muscles used in a CNA's work. The overview of the shoulders and back will highlight the importance of muscle groups and explain associated movements that may affect those muscle groups. Anatomical direction terms offer a form of communication that accurately describes body structures and how they work together. You should be familiar with 6 key terms: anterior, posterior, lateral, medial, abduction, and adduction. The term anterior is associated with the front of the body. Posterior is associated with the back sides of the body. For example, in the picture shown, we can see that the body of the sternum is anterior, in front, to the spine. And if we were speaking of the location of the spine is posterior to the sternum. The midline is a vertical line that starts in the middle of your head, going straight down, dividing the body into 2 halves. Directions refer to toward or away from the midline. Lateral refers to the limbs further away from the body's midline. For example, the arms are lateral to the chest as they are further away from the body's midline. Medial refers to the areas toward the middle of the center midline of the body. For example, the chest is medial to the arms. Abduction and adduction are associated with the movement of the limbs in certain directions. Here is a visual representation of a person performing the 2 movements. In abduction, the limbs are moving away from the midline of the body. In adduction, the arms are moving closer to the body near the thighs. Origin, action, and insertion are other forms of communication used by various healthcare professionals. Origin refers to the place of contact the muscle head originates from, generally in a fixed position. All muscle groups must originate from a bone. Action is the forced contraction or shortening of the muscle that causes movement. The general movements you can keep in mind are flexion, which is a contraction, and extension, which is a relaxed or stretched state. Insertion refers to the opposite side of the same muscle connected to a more movable bone. In the image, you can see the origin of the bicep is the anterior and posterior scapula, known as the shoulder blade. The insertion is the radius in the forearm. When the bicep is flexed, the bicep action is contraction, lifting the radius bone. When the arm is extended, the bicep relaxes while the triceps contracts to pull the arms straight. It is important to know where muscles connect because it helps explain our movements so that we can understand or reduce potential injuries. Flexion refers to any time a joint is closing or the joint angle is becoming smaller. For example, if the arm is bent at the elbow, not only are the biceps being contracted, but flexion is occurring because the joint angle has become smaller. Extension could be regarded as the opposite of flexion. In extension, the joint angle is increasing, and the muscle group tends to return to its starting position as it relaxes. For example, when the biceps are relaxed and return to the original starting position, the joint angle is increasing and muscle groups are relaxing. Rotation refers to all type of movements made around the central axis. Rotation is normally seen at the head, limbs, and vertebrae. Lateral or external rotation is when a body part is moving away from the body's midline. Medial or internal rotation is when a body part is moving towards the body's midline. As you may know, your shoulders and back are important to everyday life and your work. The shoulders and back are used if you are closing a door, helping a patient out of bed, or pouring your morning cup of coffee. This muscle group is involved. We will discuss how to understand proper movements and prevent injury. The rotator cuff is important for providing a range of muscle movements to the arm. It is a set of muscles that enable the rotation and raising of the arm. The rotator cuff includes 4 sets of muscles: subscapularis, supraspinatus, infraspinatus, and teres minor. Let's review each muscle set's origin, insertion, and action. On the anterior side of a shoulder blade, between the ribs in the shoulder blade, you have the subscapularis, known for the arm's internal rotation. That rotation turns your humerus bone toward the chest. The subscapularis originates from the scapula, which is commonly known as the shoulder blade. It inserts at the lesser tubercle of the humerus, which is the very top portion of the humerus in the arm. Tears in this muscle group are associated with aging, trauma, and overuse. Supraspinatus. The supraspinatus is located on the posterior portion of the shoulder blade. It is known for the abduction and internal rotation of the arm. This is one of the most powerful muscles of the rotator cuff. This muscle is commonly used when reaching for the top shelf or helping a patient put on a shirt. This muscle originates from the lateral border of the scapula. It inserts at the greater tubercle of the humerus. Tears in this muscle occur from lifting heavy objects, falling on your shoulder, or dislocation of the shoulder. The infraspinatus is located on the posterior portion of the shoulder. This muscle is responsible for the external rotation of the arm at the shoulder. From opening cabinets or putting a footrest on a wheelchair, these types of movements affect this muscle. This muscle originates at the scapula. It inserts at the greater tubercle of the humerus. A tear can occur from repetitive stress and hyperextension. The teres minor is one of the last posterior shoulder muscles connected to the rotator cuff. This muscle stabilizes the humerus's ball, socket joint, and lateral rotation. The teres minor originates from the posterior surface of the scapula. It inserts at the greater tubercle of the humerus. Tears to this muscle group occur from trauma, rapid use of force, or a direct blow to the shoulder. In addition to the rotator cuff, the deltoid also raises the arm over the head. There are three main parts of the deltoid muscle. 1. Anterior head. This head is responsible for rotation of the joint and allows for the extension of the arm. In conjunction of one another, the anterior head provides flexion and medial rotation of the shoulder. 2. Lateral head. The lateral head is the medial head of the three. This head allows abduction of the arm and lateral extension of the shoulder joint. 3. Posterior head. Lastly, the posterior head is the final head of the shoulder muscle. With the muscle being located on the back of the shoulder, it allows for the rotation and extension of the arm backwards and outward. Since it is such a big muscle, each head has a distinct action that goes along with it. Those actions include the flexion, extension, and rotation of the arm. The back is responsible for various movements that can cause serious strains and tears. These injuries are due to improper lifting, bad posture, and the deficiency of exercise. Knowing these risk factors and keeping a constant reminder to purposefully protect your health throughout your day is important. The trapezius extends from the top of the neck to the middle of the back. It originates from the spine of the vertical and thoracic vertebrae, which is why it can extend down the body. This muscle inserts at various places, hence why it has multiple actions. It inserts at the clavicle, scapula, and acromion. It elevates, retracts, and depresses the scapula. A person can be seen using this muscle anytime they are lifting their arms laterally, shrugging their shoulders, or pulling on heavy objects. The latissimus dorsi is one of the largest muscles in the back. It originates from the thoracic and lumbar vertebrae. It is responsible for adduction, medial rotation, and arm extension at the shoulder joint. Lastly, it inserts at the intertubercular groove of the humerus. As a CNA, this muscle group is always used. That can be opening a door, lifting a patient out of bed, or twisting the top of your favorite beverage. This is an important muscle to keep healthy. A strain in this muscle limits mobility in ways you would not believe. Everyday activities become more physically demanding when a muscle like this is damaged. Injuries to this muscle group happen by overuse, poor lifting and pulling techniques, or repeatedly reaching forward or overhead with force. Herniated discs are not considered muscle injuries, but are common injuries associated with CNAs. A disc refers to jelly-like cushions between each vertebra in the spine. Herniated discs occur from wear and tear and become more prone to tears and ruptures. There are numerous ways to encounter a herniated disc, which makes it essential to know the risk factors. Being sedentary, smoking, repetitive lifting, bending, twisting, and pulling are all ways of increasing the risk of getting a herniated disc. By having a basic understanding of anatomy and how your body works, you can make informed decisions about body mechanics and patient care techniques. This knowledge is essential for maintaining your own health and safety, as well as that of your patients as a CNA. If you're ever unsure about a specific task, don't hesitate to ask for guidance from your supervisors or colleagues.